Hello, Dr. Reema here once again from Reema's Regime. Today I'm going to discuss diet in hypertension, but before that, I would briefly discuss what hypertension is. Blood pressure is the force of the column of arterial blood against the vessel wall. High blood pressure, also called hypertension, means the pressure in your arteries is above the normal range, and what we eat definitely affects our blood pressure. The role of nutrition in blood pressure. Certain foods, they result in increased blood pressure, while other foods, they help in lowering the blood pressure. Whenever we gain weight, there is a tendency of high blood pressure, and whenever we lose weight, it helps to reduce the blood pressure. Hypertension or high blood pressure is the most common preventable risk factor for heart disease. So, it is important to fight blood pressure. Walking, meditation helps to reduce the stress level, along with the consumption of DASH diet, that is the dietary approach to stop hypertension, also helps in controlling or reducing the blood pressure. Lifestyle changes and dietary modification really helps. Now, let us discuss the foods to be included in diet. Leafy greens or the green leafy vegetables, they are rich in potassium and magnesium. Potassium and magnesium, being the key minerals to control the hypertension, helps in reducing the blood pressure. Potassium helps to flush out the excess sodium and magnesium, thereby promoting healthy blood flow. The broccoli contains all the three important minerals to control hypertension: potassium, magnesium, and calcium. Sulforaphane, active ingredient in crucifer vegetables, follows the metabolic path which leads to the reduction in the blood pressure. And these cruciferous vegetables includes cauliflower, Brussels sprouts, turnip, and broccoli. Consumption of 250 ml of beetroot juice every day helps in reducing the blood pressure by 10 mm of mercury. The secret ingredient, nitrate, helps to widen the blood vessels and aids the blood flow. Calcium, iron, and magnesium improves the heart functions and digestion.
Sesame and rice bran oil plays a positive role in regulating blood pressure in mild and moderate hypertension. Fatty acids and antioxidants such as sesamin, sesamol, sesamolin, and oryzanol play a vital role in controlling the blood pressure. Potassium plays an important role in controlling the blood pressure. Banana, being a great source, contains around 420 milligrams of potassium, which is roughly 10 to 11% of the daily dietary requirement. Inclusion of a fistful of berries helps in lowering the blood pressure due to the presence of the flavonoids.
White beans contain all the three minerals required for healthy heart. A cup of white beans contains around 1200 milligrams of potassium, which makes around 25% of the daily requirement, and 30% of the daily requirement of magnesium, and 13% of the daily requirement of calcium.
Flavanol, an antioxidant in dark chocolate, increases the vascular elasticity and improves the circulation. Consumption of 30 grams of 70% of the dark chocolate each day is heart friendly.
Inclusion of 30 grams of flax seeds every day helps in lowering systolic blood pressure by 15 mm of mercury and diastolics by 7 mm of mercury per day. Consumption of 1.5 cup of pomegranate juice helps to lower both the systolic and diastolic blood pressure and is a real heart-friendly drink. Inclusion of oatmeal lowers both the systolic and diastolic blood pressure. The beta-glucan fiber in oatmeal lowers the blood pressure by 7.5 to 5.5 mm of mercury. Lentils are rich in protein, fiber and potassium and hence really useful in blood pressure. 100 grams of split bread lentil has more potassium than what banana has. Garlic is known to lower the cholesterol and also the blood pressure.
Intake of 3 kiwis for 8 weeks can help in lowering the blood pressure by 8 to 10 mm of mercury. Kiwis can lower the risk of stroke and heart disease by providing a boost of vitamin C. Besides, they are rich in high level of dietary fiber, which keeps a watch on the LDL. Citrulline in watermelon is converted to arginine. This helps to produce a gas, nitric oxide, which is a vasodilator and thus reduces the blood pressure.
Fat-free dairy products are heart-friendly. Milk provides around 350 milligrams of potassium per cup. Yogurt is very helpful in controlling the blood pressure. It prevents the formation of cholesterol. Calcium also helps in tightening and relaxing the vessels as and when necessary. Omega-3 rich foods like fish and olive oil are heart-friendly. Steamed and baked fish consumed 2 to 3 times a week helps in reducing both systolic and diastolic blood pressure. The olive oil is rich in oleic acid and antioxidant polyphenols. They help to fight the inflammation and reduce the blood pressure. It also protects against the platelet aggregation and blood thickening. Now, what are the foods to be avoided when you are suffering from high blood pressure or hypertension? Reduce the consumption of salt and sodium. For that, you have to cut down the intake of bakery products like breads, pizzas, buns, burgers, pastries, biscuits, and so on. Cold cuts should not be consumed. Cured meats should be avoided. Tacos should be minimized. Chips and savories should be avoided. Pickles should be avoided altogether. Frozen and processed food should not be consumed. Sugar and sugar products should be avoided. Foods with trans fatty acid and saturated fatty acids should not be consumed at all. Thank you for watching. Follow my channel and find me on Facebook and Insta for many more such tips.